Thank you all for coming. Welcome to our special anniversary event celebrating 10 years of oral health integration through our national centre, the Australian Centre for Integration of Oral Health, or what we like to call ACIOH. A big thanks to everyone who have turned up in person, braving the weather and online to support this event. It's truly humbling to see such a large turnout, considering the weather, and such a diverse group of academics, clinicians, policymakers from various disciplines here. And a very big thanks to Ingham and Heritage Centre for allowing us to use this amazing facility. Many of you may not have seen this facility. It's very new, the Heritage Centre for Robotics, and it's a very ability for us to conduct events in a hybrid format, which is amazing. For those of you who don't know me, my name is Professor George, and I'm the co-founder and director of ACIOH. And for today, I'll be your MC as well. So I'd like to start off by acknowledging the traditional custodians of the lands in which we are meeting today. And for us here in Liverpool, it is the Darug Nation. I also acknowledge the traditional custodians of the various lands on which everyone online is joining from. I pay my respects to elders past and present and extend that respect to celebrate the rich cultural diversity of all First Nations people here today. Before we start, just some housekeeping rules, guys. So the toilets are around on the side. In case of an emergency, the evacuation is on that side of the door there, or as the way you came. The first aid is right over there, and we follow the instructions of the warden, which is the person, lovely Liz there, right? So essentially, today's program is divided into three parts. The last part, you'll hear messages from academics, clinicians, and students that have been collaborating with us over the years. And we'll end off with a toast of our collective achievements and to the future direction. And we've got non-alcoholic wine for you guys. And we will be circling that to you guys. So to start the proceedings, I would like to take you all on a journey that spanned more than 15 years. All of you know about ACIOH, but not many of you know how we got here. And I think it is important to share and acknowledge our important roots. I, for one, never forget where we started, and I think it helps us to be grounded. The first part will involve some introductions for myself and our interim dean from the School of Nursing and Midwifery, who's going to be joining online. This will be followed by short messages from our various partners across Australia. Some of them are pre-recorded. We will then have a 15-minute break where we will first take a group photo, because I know some people have to leave, so I want to capture, and Luke, our wonderful photographer, will tell us how we're going to stand so we can capture the guys online as well. Followed by some refreshments. And by all means, you can go during the time we're talking to pick up your refreshments there. Way back in 2009, when I joined the Centre for Applied Nursing Research as a postdoc, we started conceptualizing the idea of whether we could train midwives to promote oral health among pregnant women. Now, at that time, this was an absolutely crazy idea to everyone. This is not what midwives did. At that time, it was really a crazy idea for midwives. They were like, well, this is not what we do. And for many in the dental profession, this was not something that they were very supportive of. It was kind of, expanding someone else's scope of practice. So we got a lot of resistance from everyone, but it was my manager, and I'm hoping she's online, I think she is, and my mentor, Professor Marie Johnson. Marie, you're there, right? Aren't you? I think she is there.
I've just come off mute. Yes, I am.
Okay, thank you. Who taught me to be resilient and to think big. And we slowly started getting allies, firstly from the midwifery discipline. Our first champion was the midwifery unit manager at Campbelltown Hospital, Sharon Ellis, who became a very strong advocate. So Sharon's, right at the end there, very strong advocate for oral health. And then came Professor Hannah Darling here, who just joined the university, but she was the ex-president of the Australian College of Midwives. And Hannah was a very, very strong champion for promoting maternal oral health. A pivotal point for us was also when we met Professor Samir Boley. And Samir, I'm hoping you're online. Are you there, Samir?
Yes, I am.
Perfect. So Samir was at the time the Director of Oral Health Services of Sydney Southwest Area Health Services. We were one big area health service at the time. And Associate Professor Shupia Jwani, who's here as well, who was the head of Oral Health Research and Promotion. And they both agreed to join our team. And at that time, challenging the status quo. We were getting a lot of resistance that this is not going to happen. And so it was really refreshing to get their buy-in and their support. And so with this team, we slowly started building momentum, and we trained the first batch of midwives in Australia at Campbelltown Hospital in oral health. And then the program went from strength to strength. We attracted NHMRC funding. It got rolled out as a national CPD program. It informed policy and practice across various states, including Victoria. And in the last 2 years, it actually got endorsed by the WHO as a best practice model. So, so the success of this flagship program really provided us the foundation to explore in 2015, setting up an interprofessional oral health research group called Cohort between the School of Nursing and Midwifery at WSU and Southwestern Sydney Oral Health Services, based at the Ingham Institute. Again, this was unheard of at that time. A nursing school and a public oral health services joining forces together. And it took leadership. And at that time, leadership from the Dean, Emeritus Professor Rhonda Griffiths, who has kindly come here. So thank you, Rhonda, for attending. As well as the Director of Oral Health at the time, Associate Professor Ravi Srinivas here in the front, and the Chief Executive, Amanda Larkin, to truly believe and support this out-of-this-box initiative. Now, that started a movement that very quickly grew in strength. And we became a research center very quickly. And then Nepean Blue Mountains joined us as a partner under the leadership of Associate Professor Albert Yacoub. And then in 2021, through the support of the Network for Integration of Oral Health, you can see on the bottom left there, and the late Dean, Professor Deborah Hatcher, we became Australia's first national centre in integrated oral health care. And you can see on the right here, as our first research assistant, Amy, who was there when we started. We just had one computer, one RA, and she was with us till we became a national centre. And if you look really carefully at the screen at the back, you'll see how our logos changed along the years to finally reach to ACIOH. So it's been a journey. It's been a long journey. A lot of challenges along the way. But 10 years on, we are now a globally recognized interprofessional research center with numerous partners nationally and internationally. And to my knowledge, we're the only research center globally having such a formal collaboration between nursing and midwifery and oral health. We are delivering real-world impact, improving patient outcomes, influencing policy and practice nationally and internationally. Our models of care are being adapted and adopted in various settings and are cost-effective, sustainable, and scalable. We've also become a very much sought-after training center for early career researchers, interns, and higher degree students from various disciplines. Over the last 1 year, I've had the privilege of interacting with public health leaders at a global stage. We were invited last year to the first ever global oral health meet in Thailand. There I interacted with leading professors at King's College, Harvard, more recently people from Johns Hopkins University, and with various governments at different countries. And I can tell you now, and I'm not someone who likes to blow my trumpet, right? But I can tell you now that they're all very envious of what we're doing here. And they really want to adopt the models that we are implementing. We are not just talking about what needs to be done. We're actually engaging in research translation and making a difference. The best thing is that many of these initiatives are being led by the non-dental workforce, which is true integration. And if I look at the room here and I do a head count, I'm sure I can see there are more non-dental than dental. That is evidence of integration. And this doesn't happen normally in the oral health space. So, I'm really, really proud that this is happening, and it's taken a while, but it's there. And, we are really changing the paradigm on how we address oral health. And because of that, and because we started early, we're actually ahead of the curve. And we're in a very strong position to support the implementation of WHO's new Global Oral Health Action Plan, which has a big focus on integration. So, on that note, it gives me great pleasure to launch ACIOH's 5-year research report. Some of our official partners have been provided hard copies, should be there, but for the rest of you, please, you can download the QR code on this through the QR on the screen, and you will get a link. One of my colleagues will be putting a link there for you to click online. We're extremely proud of this report, which has been a huge undertaking for the last 12 months. A big thanks to my research team, especially Dr. Ariana Kong, who was one of our old staff and PhD students, went to UK, and she's decided to come back and join us, which is amazing. Robin, Jacob, and Alicia for designing the report. So when you look at the report, you'll notice that everything has actually been done in-house. The design, the color scheme is all done in-house. And a big thanks to the various partners and collaborators who have contributed to the success of this document. Through this document, we have tried to show that ACIOH is not just about publications, grants, and conferences, and you can see we deliberately put that all the way at the back of the report, okay? But really, it's about research translation and impact, working with consumers and stakeholders to address health inequalities, and most importantly, providing a supportive training and mentoring environment to nurture future researchers and foster research excellence. I'm particularly proud of the front photo, as it is ACIOH's first baby, born to one of our previous PhD students, Tiffany. She joined us as an undergraduate research intern years ago, but left last year with a PhD, a loving husband, 3 children, 1 for every PhD paper she published, and a permanent associate lecturer position in public health at WSU. In fact, I recently found out that she was actually pregnant with a 4th child when we were at the graduation a couple of months ago. And she's due anytime now. That's why she's not. She had the baby. She had the baby. Wow. Okay. So that's it. Very apt. So that's why she can't be here. So, these are the stories that make me get up from bed every day and, seeing that we are making a difference. So on that note, I'd like to thank you again for coming. And I'm going to now hand over to our interim dean from the School of Nursing and Midwifery, Professor Jane Frost, to share a few words. Jane, are you there?
Yes. Hi, everyone. And my apologies for not being there in person. We had an urgent meeting with the Faculty of Health, or the newly to be formed Faculty of Health, and I just couldn't make it across in time. So I'm really sorry that I couldn't join you this afternoon. As the interim dean of the School of Nursing and Midwifery, it is an absolute privilege to take a moment today to acknowledge the outstanding achievements of the Australian Centre for Integration of Oral Health, or ACIOH, a flagship research centre within our school that continues to make history and impact across nursing, midwifery and oral health. And I'm going to repeat some of the accolades and some of the things that Ajesh has already mentioned, but I think they're worth repeating. So ACIOH holds a truly unique place in Australian higher education. We are the first nursing school in Australia to establish an interprofessional oral health research centre with formal partnerships with public dental services. This is a significant milestone, one that reflects our school's commitment to innovation, collaboration, and improving health outcomes for communities. Over the last 10 years, Cohort and then ACIOH has built an impressive National and international reputation. The centre has attracted more than $11 million in research funding, including from the NHMRC, produced over 130 peer-reviewed publications, and most importantly, delivered real-world impact across policy, education, and practice. It has been endorsed by the World Health Organization, contributed to the development of national oral health training programs and micro-credentials, and has influenced policy and practice here in Australia and beyond. Closer to home, ACIOH led the integration of oral health modules in our undergraduate nursing and midwifery programs at Western Sydney and Australia First. This initiative has since inspired universities across the country to embed oral health in their own curricula, a clear example of Western Sydney's leadership in education and health innovation. This centre has also had a remarkable impact in developing research capacity. To date, ACIOH has attracted more than 24 HDR and master students with 14 completions, and has secured 8 PhD scholarships through the NHMRC, New South Wales Health and WSU partnerships. More than 20 academics across the School of Nursing and Midwifery, the School of Medicine and the School of Health Sciences have contributed to ACIOH projects, gaining mentorship opportunities to supervise research students and to participate in large multidisciplinary grants. ACIOH has a strong record in integrated oral health research, has also led to formal partnerships with leading international institutes, further extending its influence and reach. I want to take this opportunity to acknowledge the co-founder and director of the centre, Professor ACIOH George, for his vision, leadership and continued dedication to growing and delivering on the centre's key focus of integrating oral health into general health systems and training of the broader workforce. So can we just give ACIOH a round of applause? I know I'm not in the room, but I'm sure you can all do that for me. Thank you. I'd like to thank all of our valuable partners across public health services, state governance, professional organisations and beyond who have supported ACIOH's journey over the last years. And of course, a special thanks to the Ingham Institute for providing a home for the centre, a place where collaboration, innovation and impact continues to thrive. Sounds like you're going to have an amazing afternoon. I wish I could be with you, but thank you.
Thank you, Jane. All right, so now you're going to hear from our partners. Yes, I'd like to introduce you to Simone Prompt, the CEO of the Ingham Institute for Applied Medical Research. Simone, thank you.
Thank you so much, ACIOH, and how wonderful it is to be here today. Welcome to everyone to the Ingham Institute and the Perrett Centre for Robotics and Health Technology. I'd like to begin by acknowledging the traditional custodians of the lands on which we meet today, the Cabral land of the Darug Nation, and pay my respects to elders past and present, and extend those respects to any Aboriginal people here today. So it's such a pleasure to join you all here as we celebrate the 10 years of the Australian Centre for Integration of Oral Health. On behalf of the Ingham Institute, I want to acknowledge what an extraordinary decade this has been for ACIOH, for your partners, and most importantly, for the communities whose health has been improved through your work. ACIOH began with a clear and ambitious vision to bring oral health into the heart of mainstream care across maternity services, primary care, aged care, mental health, disability, and community settings. 10 years on, that vision, as we're hearing today, is being realised every day through the programs, research, training, and service models you've created. You are shaping care pathways and influencing policy across Australia and the world. At the Ingham Institute, we are incredibly proud of ACIOH and to be a partner of ACIOH. You embody our mission of pioneering global health equity through translational research, beginning in our communities who need it most. By integrating oral health with general health, you're improving quality of life, reducing preventable illness, and creating healthier communities. To Ajesh, the leadership team, every researcher, clinician, partner, and supporter, both current and past, congratulations. 10 years is a significant milestone, and it marks the beginning of an even more impactful decade ahead, if we can believe it. Thank you so much.
Thanks so much, Simone. I'd now like to call Associate Professor Ravi Srinivas from Southwest Sydney Local Health District. I just want to acknowledge Southwestern Sydney has been our inaugural partner for a very long time. You know, they've been with us through thick and thin. So it's a special connection. And so thank you, Ravi. Over to
you. Yeah. Thank you, Ajesh. And before we start, we just want to pay our respects to the traditional custodians of the lands on which we meet, Daru, Kantankara, and Tarawal. So we all will acknowledge all our Aboriginal elders and also pay our respects to any Aboriginal colleagues who are in this meeting today. So, you know, when we started this 10 years back, Ajesh and I were looking at each other and thinking, well, he has to survive a person like me and, you know, we have to work together. But it's amazing that we put on the journey and gathered more people in the process. So one of the things which we talked about when we initially came to Ingham Institute, and I think we were talking about this to somebody at Ingham, and we talked about bench to chair side. So what we think on your bench side, from bench to chair side is basically translating research. So the original acronym for cohort was, there was a translation, the T stood for translation. I think the center C was a collaboration. And we were always thinking, how do we look at integrated care? What do we do to take it out of dentistry altogether? Because one of the challenges with oral health research, it stays with dentistry. So I must say, Western Sydney University School of Nursing and Midwifery, the most odd combination came into play. And we had this fantastic vision from the dean and the chief executive to actually put together a partnership which has stood the test of time. The other important aspect for us at that stage was looking at evidence-based practice. A lot of the things are hypothetical. You can say these things will work, but we don't know whether it will work or not. So that was one of the things we had to work on. And looking at translating it, then we realized that research methodology is important. We're quite heavily qualitatively based research teams, and we've got a very good skill set around conducting and completing qualitative research. Some of the key projects in mind, which we're pretty proud of, was palliative care project Palio. And Ajesh has got this amazing ability of putting IO after every project. He can brand a project easily. We have Palio, we got cardio, we got bio, we got some other O's, DO, I believe, as well. But palliative care was interesting because that came out from a seeding grant we got from the district. So district had given us a seeding grant for, I think, $5,000. There you go. Thank you. And that started all this. So we started with the palliative care team and with Jenny Harlem and Jennifer Wilshire from Palliative Care Medicine. And then we realized that neither dentists nor palliative care doctors know what's happening. We don't know what end-of-life care plans are. And doctors were not able to understand why dentistry is important for someone who's got at end of life. And so we did a lot of work, and I believe Vipin's doing his PhD right now. So well done. You know, he's got one paper in, and that's amazing. The other one, which we are proud of, was the Grinning Mums and Bubs project, which I think Ariana led with the Aboriginal health workers and pregnant women. And that paper has been cited in various places, not only here, but overseas, about how Indigenous cultures and communities will be respected and partnered in research programs. The last highlight, which I don't not been touched upon, maybe I just want to talk about, is the consumer engagement. We were one of the first research groups which actually had consumer participation quite actively built in when we devised methodologies or program protocols and so forth. So some of the things which we got, amazing work, and hope for another, like we got 10 years in, we hope for a lot more time, 10 more years, and hopefully we build a profile and contribute to a meaningful way to the healthcare outcomes of our communities. And that's the main purpose, I think, Ajesh, under his leadership, we have been able to demonstrate. So thank you once again, and congratulations to everybody involved in this wonderful center. Thank you.
Thank you, Ravi, for those kind words. Excellent. I would now like to call on our next partner, who has also been through the journey with us, starting with cohort and then ACIOH, Associate Professor Albert Yacoub, who is the General Manager of Oral Health Service in Nepean. Over to you, Albert. Thank you.
Thank you, Ajesh, and very kind introduction and mention of Nepean Blue Mountain. It is my pleasure to be invited and participate in this event. Thank you very much for the invitation. 10 years is a long journey. Well done, mate. And our partnership started officially with ACIOH 10 years ago. It was cohort, a predecessor of ACIOH. Since then, we completed several major oral health projects together. Most importantly is our partnership with the MIO project. This project was a major milestone in integrating oral health, as you mentioned. Integrating oral health with the overall health system. This project established a framework for integrating and embedding oral health in antenatal care, and demonstrated true integration, and demonstrated that oral health messages and benefits can be delivered for expecting mothers in an effective way through non-dental staff. Over the years, we also partnered with Ajesh and his team in delivering several other projects dedicated to improving public oral health. Our partnership resulted in lots of projects, over 10 publications, and several awards, which we're very proud of. We all learn a lot. We learn a great deal of research from you, mate, and from all of your team. Your dedication, your professionalism, everybody in cohort and ACIOH were exemplary. Your passion for delivering and leading meaningful, impactful research that translated into service and care were demonstrated across the last 10 years. And they were very contagious. We became infected at Nepean Blue Mountain. We now think more about research than we used to. So that's thanks to you and your team. We currently have several exciting projects with ACIOH covering oral health quality of life. We have a very exciting project about the perception and awareness of public oral health service across New South Wales, identifying the oral health risk factors for primary school children. And more importantly, we are having a very big project, integrating project, which is about integrating oral health promotion for children with intellectual and developmental disabilities. This project is through integration with our OT partners, and Tanya is leading this project, part of her PhD degree. So I would like to finish by thanking you and your team. Been amazing 10 years. Our partnership started only 2017, but we knew each other from the beginning. I and my team are looking forward for many more years of collaboration with ACIOH, many more projects, many more research, many more publications and awards. Thank you.
Thank you, Albert. So I hope you guys don't get bored with all the speeches, all right? It's very short. We said 3 minutes, right? So we will have a break. So I'd like to call on our next partner, Sydney Local District, and Associate Professor Shubhir Jawani. I know I'm going a bit off script. I know Samir is online as well. So if we have time, Samir, would love you to share a few words if you want to after Shubhir's thing. So I'm going to give you some time to think. So I'll let Shubhir come on board.
Thanks, Ajesh.
Good afternoon, everybody. And I'd like to also begin by acknowledging the traditional owners of your meeting. And I'd like to pay my respects to elders, past, present, and emerging, and to all Aboriginal and Torres Strait Islanders. members who have joined us today. It's a really exciting time, and thank you, Jesh, for inviting Sydney Local Health District and me on behalf of Sydney Local Health District to celebrate this important milestone, celebrating 10 years of integrated oral health research through a wonderful center that's ACIOH. Our partnership represents a shared vision to embed oral health into broader healthcare system, ensuring that patients receive holistic and integrated care. Through joint research, education, and clinical initiatives, we are breaking down silos and creating models to improve health outcomes and initiatives that are having meaningful impact on the community. Through our partnership, we are setting benchmarks of innovation and collaboration in oral health integration, and that's largely due to a wonderful collaborative partner in ACIOH. Through our partnership, although our partnership is over 10 years old, as Jesh pointed out, I think we started in one of the small offices not so far away, long time ago, shows how long we have been in this field. In the last 5 years since the formation of ACIOH, this partnership has been a catalyst for more innovation and impact. Together, we have initiated 17 collaborative projects with Sydney Local Health Districts, resulting in over 16 publications, and we have showcased numerous papers in national and international conferences. But beyond research, I think this partnership has also strengthened the staff capacity and capability in Sydney Local Health District. In partnership with ACIOH, we ran 12 research training seminars, which are now hosted in the ministry as well, to improve and build capacity of clinicians in research. Through our collaboration, we have had 3 PhD students, 13 bachelor and master students, and have employed ACIOH research staff to support SLHD projects. And again, this has been mainly because we've had close partnership with the ACIOH research team and ACIOH in particular. And these achievements demonstrate the power of partnership. By working together, we have advanced research, improved clinical practice, and created resources that benefit our communities in years to come. So I would like to thank ACIOH and all our collaborators which are part of ACIOH, and look forward to many more continuing years and journey of success. Thank you very much.
I echo everything that Shilpi has already said and other speakers. It's been a fantastic journey, and the aim of this journey was to bring oral health and integrate it with other aspects of health. And it's been absolutely fantastic to have had that, have been part of that journey. I wish ACIOH all the very best, and particularly thank you for your leadership, and continue to, we continue to build on it. Thank you very much.
Thank you, Samir. I forgot to mention, those who don't know, Professor Samir Bola is the Director of Oral Services at Sydney Local District. Okay. So we've had a very long-standing relationship with the Australian College of Midwives. They're one of the first professional organizations that endorsed our training, and way back in 2011, and they've been rolling out the program across the country. Christy was going to try and make it, but unfortunately had to do a pre-recording.
My name is Christy Watson, and I am the Midwifery Education Manager at the Australian College of Midwives. It is a privilege to join you in celebrating 10 years of leadership, innovation and impact from the Australian Centre for Integration of Oral Health. This milestone recognises a decade of advancing oral health across the population, strengthening prevention, building evidence and bringing health professionals together to enhance health outcomes for all Australians. At the Australian College of Midwives, we are proud to contribute to this broader movement. Our partnership with the Australian Centre for Integration of Oral Health reflects a shared belief that oral health is fundamental to overall health, and that integrating it across health disciplines creates meaningful, lasting change. Within midwifery care, this work has particular significance. Midwives are ideally placed to support oral health during pregnancy, a time marked by rapid physiological changes, increased engagement with health services, and opportunities to guide women towards informed preventative health care. Through our collaboration with the Australian Centre for Integration of Oral Health, we have helped elevate this part of midwifery practice, ensuring oral health promotion is recognised as a valuable component of comprehensive care. A key achievement in this space has been the midwifery-initiated oral health course. This 16-hour program builds knowledge of oral health conditions in pregnancy, the influence of hormonal changes, barriers that women face, the effective approaches to screening, assessment, and education. It enables midwives to identify common issues, provide tailored guidance and support, and timely referral. With strong uptake across Australia and outstanding support from partners such as Oral Health Victoria, this course continues to extend its reach and impact. What stands out most when marking this anniversary is the collective efforts represented here today. The success of the Australian Centre for Institute of Oral Health is built on collaboration, bringing together researchers, clinicians, educators, policymakers, and community partners, each contributing essential expertise to a system where oral health is integrated, preventative, equitable, and recognised as central across the lifespan. The celebration honours more than 10 years of work. It honours a vision that oral health belongs in every conversation about health. It honours the partnerships that give that vision strength, and it honours a shared commitment to improving the well-being of individuals, families, and communities throughout Australia. On behalf of the Australian College of Midwives, congratulations to the Australian Centre for Integration of Oral Health on this remarkable milestone. We deeply value your leadership, expertise, and partnership, and we look forward to continuing this important work together. Thank you. My name is Christy Watson, and I am the Midwifery Education Manager at the Australian College of Midwives.
That's yep. Okay. Thank you. Now, with any research, you need to be able to work with policymakers. Otherwise, it doesn't get really translated into practice. And so we've been very fortunate, had a good relationship with the Centre for Health Strategy at the Ministry of Health. And we actually have two representatives here, Cara and Natalia. Thank you for coming, braving the weather, coming all the way from the other side. So much appreciated. So I'd like to, Graham is online. Graham, we're just going to try and get you on the screen.
No worries. Hi, everyone. Look, my apologies for not being there in person. I wish I could have been there in person, but just wasn't possible today. I want to start by acknowledging also the traditional owners of the lands that we're meeting on, and just acknowledge that I'm joining today from Darkinjung country, which is hugely beautiful, but I'm in the middle of a thunderstorm at the moment. So if the thunder does sort of drown me out, then my apologies for that. Just bear with me. The Ministry of Health has a really strong focus on integrated care. I think anybody who's read any of the recent strategy documents, either for all of New South Wales Health or for the Centre for Oral Health Strategy, would be able to see that pretty clearly. We're focused pretty strongly on the phrase that's been around for a very long time now, putting the mouth back into health. And a very, very strong focus on priority populations, equity of access, and equity of outcomes. I think it's clear to everyone in the room that provides really almost a perfect alignment with the objectives of ACIOH. And so the partnership that we have is a pretty obvious one. We are partnering on key projects across diabetes, including ACIOH having received quite a large Commonwealth grant through the NHMRC targeted call for research, which is certainly a big achievement. So congratulations on that. Alcohol and other drugs, intellectual disability, cardiovascular disease, and other things. And all of those are focused on improving health outcomes for patients, particularly oral health outcomes for patients, but also other health outcomes through integrating oral health care with general healthcare delivery. The ACIOH effectively works as a force multiplier for the Centre for Oral Health Strategy. We are quite a small centre, and the partnership that we have with ACIOH really serves to provide a significant enhancement on what we can achieve within our existing resources, and has led to really demonstrable health outcomes for our patients. And those are patients who are the most in need patients across New South Wales. And so I just want to say thank you. Congratulations, Ajesh and the team on this huge milestone. And just to say that we are very much looking forward to continued partnership and continued improved health outcomes for patients across the state.
Brian, thank you so much. Get the president. I just came back from a international conference, and I think one of the things that was quite stark that we sometimes take for granted in Australia is we actually can speak and approach policymakers and engage in research. I was shocked, but very often government organizations don't talk to private organizations or let alone universities. So I think we're quite fortunate that we can have a conversation and we can try and align what we're doing with the priorities there. And I think so we value this relationship with the ministry. I think it's been beneficial for both of us. All right, hang in there, guys. There's 2 more videos and then we're done for the break. All right. So Oral Health Victoria, previously known as Dental Health Services Victoria, have been a very, very strong partner. They adopted the midwifery model way back in 2011. They influenced their policy. They rolled it out across the state. I think more than 500 midwives in Victoria have done the training. They've used the undergraduate midwifery curriculum and influenced 9 universities in Victoria to adopt it. They've been an active partner and they were going to fly 2 of their staff for the event. Unfortunately, today is their Christmas. Susan McKee, the CEO, has shared a video. So I'm going to play that.
Hi, I'm Sue McKee, the Chief Executive Officer at Oral Health Victoria. Unfortunately, we're unable to be with you in person today to celebrate this important 10-year milestone. But I wanted to take a moment to acknowledge and celebrate the important partnership Oral Health Victoria has with the Australian Centre for Integration of Oral Health at Western Sydney University. Oral Health Victoria and ACIOH have been proudly working together for over a decade to integrate oral health into the broader health system, initially focusing on maternity care and now planning to expand into other primary care areas. OHV recognises the importance of good oral health throughout every stage of life, and particularly in pregnancy. As we know, physiological and behavioural changes associated with pregnancy can increase a person's risk of tooth decay and gum disease. Pregnant people deserve support to stay well to ensure positive pregnancy outcomes. In 2012, Oral Health Victoria launched the Healthy Families, Healthy Smiles program, with the goal of improving the oral health of pregnant people and children aged 0 to 5 by building the capacity of health and early childhood professionals to promote oral health. From the beginning, building the capacity of midwives to support oral health has been integral to our achieving this aim. So when the opportunity to partner with ACIOH to pilot the midwifery oral health program was available, we obviously said yes. In 2013, the Victorian pilot was a success, involving both public midwifery and career maternity services across the state. It was the beginning of what is now 12 years of partnership, enabling 472 Victorian midwives to be trained to deliver oral health advice and screening as part of their midwifery care. Additionally, with the support of ACIOH, oral health components have been successfully integrated into the midwifery undergraduate curriculum at 6 Victorian universities, ensuring newly qualified midwives understand the importance of good oral health and how to integrate this into their daily practice. More recently, ACIOH has expanded its collaboration with our population health team to strengthen the integration of oral health within the broader health promotion and primary care initiatives. Together, we'll be driving 2 key streams of work that have the potential to create lasting impact on community health outcomes. In partnership with the Australian Primary Healthcare Nurse Association, the first focus is on empowering nurses to play a stronger role in oral cancer prevention through enhanced screening and early detection. By building this capability within the nursing workforce, we will enable earlier diagnosis and improved patient outcomes. The second area advances integrated care by expanding the reach of ACIOH's diabetes and oral health training and resources across Victoria. We will support the testing of this model in local health settings to ensure it's practical, effective and sustainable. This work will help embed oral health into chronic disease management and strengthen cross-sector collaboration to improve overall wellbeing. So congratulations, ACIOH and the Western Sydney University on 10 years of collaboration and partnership with Oral Health Victoria and many others. Together, we're building a stronger, more connected health system that recognises oral health as a vital part of overall health and delivers meaningful improvements in outcomes for our community. Thank you all and enjoy the celebration.
All right, last video. We are in the age of digital health platforms, and for us to keep up with pace, we need to also adapt and adopt. So we actually formed a partnership last year with an emerging and now actually internationally recognized digital health platform, AI platform called Smilo AI. During that same time, we've also then Perit Center was created, and so we're trying to use a digital platform as a cross-cutting theme across integration. So Padma, based in Queensland, has shared a very quick video. She's actually overseas, not feeling very well, so she did a very quick video with her phone.
Hi, I'm Dr. Padma Gadia. I'm the CEO and founder of Smilo.ai. Apologies that I couldn't be there in person. I'm super delighted about this partnership with ACIOH and Professor Rajesh George and his team. Together, we are integrating digital oral health solutions, not just to chronic care, but beyond that into aged care, intellectual disability care, and making it available and accessible to everyone. Together, we want to empower healthier lives, not just in Australia, but worldwide. I look forward to another year of positive collaboration impacting lives all over the world. Thank you.
All right, so that ends our first part, guys. We are going to take a group photo now.
Just a little bit that way. Yep, perfect. Everyone else stays there. Excellent. All right, we're good. We'll just throw one more chair in.
Can I say, Luke has been here for over 10 years.
As far as long as you guys.
Been around. It's called, yeah, with Lord's. I don't. Someone more important in
We need ECS.
You're fine. I'm gonna go, what's she in the front row for?
Fantastic. Everyone here, everyone online looking here too. Lovely. Hold that for a second. Beautiful.
So a key part of the center is also working very closely with other universities. It's not just about WCUs, working with other universities who are also interested in integrated care and working with clinicians and students. So we've got a few messages from clinicians, students who are academics who are doing their PhD, but also from other universities as well. So the first one is from Professor Jenna Salamatson, who's the head of Department of School of Nursing at Wollongong University. We actually have a representative here, Professor Caleb Ferguson. Thank you, Caleb, for coming all the way from Blacktown. Much appreciated. So over to you. We'll just share the next slide. Thank you. Over to you, Jenna.
Thank you. Thanks, Ajesh. Okay, Ajesh. So good afternoon, everyone. So when I think about what makes our magic ingredient in our research partnership that is truly exceptional, the name that comes to mind is Ajesh George. Now, I came from Western Sydney University, so our collaboration has been for a few years now, and before I came to the University of Wollongong as the head of School of Nursing. So if you think of Ajesh George, he's a dentist employed by the School of Nursing and Midwifery. On paper, that seems unconventional. The discipline of nursing has not traditionally been known for interdisciplinary inclusivity. Yet Ajesh did not just find a place here in the school, but he flourished. He progressed from a fixed-term senior lecturer to a tenured internationally renowned professor, succeeding in every internal promotion milestones along the way. But having said that, he's blessed with some visionary bosses who are nurses, starting with Professor Marie Johnson. Marie, salute you. Professor Rhonda Griffith, followed by Professor Deb Hatcher, and it continues. His journey is the best example of what I know to be visionary leadership in the research partnership space. If I had to describe our collaboration between the School of Nursing in UOW with ACIOH, it's under Ajesh's leadership. 3 words come to mind: trust, value add, integrity. So trust, because genuine partnership requires confidence in one another's expertise and intention. Value add, because every collaborative activities, right, it strengthens both parties. No one is merely along for the ride. And integrity, because the work we do is grounded in shared ethical commitment to improve health outcomes. At the heart of this collaboration is simple but powerful ideas, meaningful cross-disciplinary engagement, building research capacity, and connecting oral health with broader health priorities. We have generated insights that neither of us could have achieved alone. Our partnership centers on key interdisciplinary projects. The cardio projects, and I saw you, Paula, there, explore the links between oral health and cardiovascular outcome. The Ionic project, again, hi to you, Jacqueline, embedding oral health education into the nursing curriculum. And the ACIOH project focuses on workforce challenges in residential aged care. And thank you, Caleb, for being there in person. The IDEAS project examines the intersection between oral health and systemic diseases. These projects are led and supported by these dedicated researchers in our school, including Dr. De La Meniza, who focuses on cultural and diverse communities and healthy aging as well. Dr. Rebecca Botsworth, who brings expertise in the custodial setting and justice health, and Professor Bronwyn Everett, who is online, Professor Caleb Ferguson in person, and we all contribute to the leadership across multiple projects. I think the result speaks for itself. 38 peer review publications, more than 13 conference presentations on the global stage, 4 research students that we've supervised and completed, and 2 competitive research grants secured. This partnership exemplifies what is possible when disciplines come together with a shared purpose, and what leadership creates the conditions of success. And we look forward to a continuing and productive relationship with ACIOH and to the discoveries that lie ahead. Thank you.
Thank you, Hannah, for those very, very kind words. One thing that we've been trying very, very ardently to do is not make it all about WSU. All right, so, this is a global issue. It is an issue that affects all population groups, all health services. And so we've been very keen to collaborate with other universities. We can all work together. We just, everyone can lead some part of it. So we've been working very closely with University of Sydney in the space. And one of the things that we've been doing is been helping with their student supervision. Next slide, please. So we've actually helped in supervising quite a few pediatric registrars at Westmead, trying to get them, they have to do a research component as part of their training, getting them to do projects in the integrated space. So the head of the program, Associate Professor Neeta Prabhu, could not make it today, but she's one of our students who has actually just submitted her thesis and is here today to share a few words, Dr. Julia Lee. So Julia, thank you for coming.
Thanks for the intro, Ajesh. So I'm Julia, and I currently completed my final year of doctorate clinical dentistry, specialising in paediatric dentistry at the University of Sydney, based at the Western Sydney Local Health District, Westmead Hospital. So I'd like to take this opportunity to formally acknowledge and thank my research supervisors, Professor Ajesh George, Associate Professor Neeta Prabhu, and Professor Amit Arora, individuals whose contributions have been integral to the process and quality of my university research project, involving a literature review and development of the resource. This project has recently been awarded a Western Sydney Quality Award and is currently in the final stages of endorsement by the Ministry of Health. So throughout the duration of this project, ACIOH and the team at ACIOH has demonstrated exceptional professionalism, expertise, and generosity with their time. Their guidance helped refine the structure and direction of my work, and ACIOH's thoughtful feedback consistently strengthened the rigor of my methodology and analysis. I am sincerely appreciative of the clarity and perspective you provided at each stage. So research of this nature requires not only an individual effort, but also the support of knowledgeable and committed contributors. The involvement of my supervisors, including ACIOH and the team at ACIOH, has significantly enhanced the depth and credibility of this project, and your willingness to engage so thoroughly has not gone unnoticed. So on behalf of staff and fellow colleagues from Westmead Hospital and the University of Sydney, we would like to extend our sincere thanks to ACIOH and the team at ACIOH. So thank you for your valuable input, your responsiveness, and your sustained support. Your contributions have played a meaningful role in the successful completion of this work, and I'm genuinely grateful for your assistance. Thank you.
Thank you, Julia. When you see the report, you'll actually see that we've also been engaging with the undergraduate dental students at the University of Sydney through SHUPI and a few others, trying to get them embedded in projects like Paula's project. So, and we've also had, I guess, almost 6 Masters of Public Health students from Wollongong University do internships. So just trying to make sure that, all universities are contributing and all part of the same journey in the integration space. The next one is, so Yenna spoke about Rebecca. Rebecca was at Wollongong, but then she just now took over the operations manager at Justice Health. So she's an ECR from a different university. And again, we were helping her in supporting her project and developing a program of research. So she's got a pre-recording as well.
Good afternoon, everyone. I'd like to begin by apologising for not being able to attend in person today. However, I'm truly honoured to speak on this occasion and to celebrate ASIO's 10-year anniversary. Congratulations to all. My name is Dr. Rebecca Bosworth, and I currently work as an operational nurse manager for the South region of Justice Health and Forensic Mental Health Network, based at South Coast Correctional Centre in Nowra. I'm also an early career researcher and previously worked at the University of Wollongong as an academic in the School of Nursing. During my time at UOW, I was introduced to Prof. ACIOH George, who quickly became a pivotal mentor in my research journey. I shared with Prof. George my observations of oral health disparities among people in prison, a concern that had stayed with me since my time as a registered nurse in correctional facilities and even earlier during my experience as a dental assistant. This passion for custodial oral health became the foundation for the work I do today. Through Prof. George, I was coincidentally introduced to Dr. Keith Heap, the Clinical Director of Oral Health at Justice Health New South Wales. This is a great example of how ASIO and Prof. George enabled collaboration between industry and academia. With a $20,000 UOW startup grant I had secured, we collaboratively established the Oral Health in Prison study, where we were exploring a new model of care from an interprofessional perspective. While our project team grew significantly, one of the highlights, and again, credit to ASIO and Prof. George for introducing us to policymakers, facilitating that connection and introducing us to the Manager of Research at the Ministry of Health Centre for Oral Health Strategy, who kindly became a collaborator on our project. As an ECR, ACIO's support was pivotal. Under the mentorship of Prof. George, I was guided in grant writing, project management, provided access to key consultants, supported to mentor and supervise interns and honours students, and connected with key stakeholders across academia, industry and policy, enabling collaborations that could assist in translating our research into practice and policy. As an ECR, this was my first grant to manage, my first experience employing research assistants and supervising interns. Prof. George guided me through every step, supporting me when challenges felt overwhelming, providing advice on managing a research team, and helping me navigate any complexities. ASIO complemented this mentorship by hosting the project team on site, providing the opportunity to plan our research, meet in person, and collaborate closely. This hands-on support strengthened our connections, enriched the research process, and gave me confidence as a new researcher. The OHIP study has produced several key outputs, including a global scoping review, looking at the role of non-dental professionals in custodial oral health, which is under review, a successful Ministry of Health Centre for Oral Health Strategy grant, and also one of the key highlights was Prof. George facilitating our whole project team to present our study at the Ministry of Health Centre for Oral Health Strategy. Recognition of our work included featuring the project on the ASIO website and receiving an invitation to become a national affiliate, valuing our contribution and connecting us to a wider professional network. We have also had the opportunity to present our research at the Justice Health conference. Prof. George's mentorship has been central to my development as an ECR. Despite his own workload, he was never too busy to provide guidance, check in when things felt overwhelming, and connect me with key stakeholders across academia, health services, and policy. There are some mentors who cross your path and leave a lasting mark, and that is Prof. George. However, his generosity extends beyond me. He has mentored many ECRs, creating opportunities and nurturing professional growth. ASIO as an organisation embodies this same commitment to mentorship, collaboration and integration. They actively support ECRs by providing guidance, resources and networks that facilitate connections with key stakeholders and enhance research capacity. Through ASIO, I've experienced firsthand how an organisation can champion both research excellence and professional development. In closing, ASIO has been instrumental in my journey as an ECR, supporting me through mentorship, collaboration, funding, hands-on project support, and opportunities to lead students and interns. With Prof. George's guidance and ASIO's organisational support, I've been able to gain confidence as a researcher, lead innovative projects, build interdisciplinary networks, and contribute to improving oral health outcomes in custodial settings. Once again, I'd like to congratulate ASIO on an incredible 10 years of supporting researchers, students, and the broader oral health community. I am deeply grateful for the lasting impact everyone at ASIO, including Prof. George, has had on my career. Enjoy the celebrations.
We've got one more video, last video, and then we've got a presentation from someone in the audience. So the last two are basically PhD students. One is an academic at Western University, and the other one is a clinician in Southwestern Sydney. So Jacqueline couldn't be here, but she's got a video. That's a last video, guys. Thank you.
Hi, my name is Jacqueline, and I am currently a PhD student and completing my studies with ACIOH. And I'm also a lecturer at the Western Sydney University School of Nursing and Midwifery. I've had a passion for oral health for a number of years now and was introduced to Professor Rajesh George in 2020, who suggested I could undertake my PhD studies in the area of integrating oral health in the undergraduate nursing curriculum. I gladly accepted this challenge and have since been involved in ACIOH and have championed oral health in the nursing education space. ACIOH has helped me expand my horizons and think outside the box. It has also allowed me to network with others who are also interested in oral health and has provided immeasurable support throughout my PhD studies. Professor George, who is one of my supervisors, has played a key and fundamental role in my studies, for which I'm very thankful for. Moving forward and thinking beyond my PhD, it is an exciting time in the School of Nursing and Midwifery. In my role as Director of Academic Program Pre-Registration Nursing, I have had the opportunity to lead the development of a new curriculum for nursing students, which excitingly enough also includes the addition of oral health material scaffolded throughout the years. The inclusion of oral health in the curriculum ranges from aged care, cardiovascular health, diabetes, and paediatric care. I am very much looking forward to seeing the education of future nurses in this space in order to be able to tackle this global health problem. And thanks to ACIOH and the School of Nursing and Midwifery, I have been able to do that. Thank you.
So Jacqueline's work is quite crucial. So no other university in Australia is actually integrating oral health into the undergraduate nursing curriculum as we're doing it in a very systematic scaffold, way. And, like I said, I came back from an international conference and where everyone was talking about how hard it is to do this in the undergraduate curriculum. We already started and we continue to do. We have Shama here. Shama, she's already started a project around integrating oral health in around aged care. So I think it's going to make a difference in the new graduates. It's going to be part of their DNA. I think it's quite exciting. And, being a national center, having those strong links with various state governments as well as we are able to share those resources so that we can really enhance that translation. All right. Last but not least, we have Alicia Johnson, clinical nurse consultant mental health from Campbelltown Hospital. Alicia, over to you.
So hi everyone, as mentioned, my name is Alicia and I am a mental health nurse working as an after hours clinical nurse consultant within South West Sydney Local Health District's mental health service, and I'm also a PhD student here with the ACIOH. So I started here at ACIOH. At the time it was cohort when I was working on a district project on site here at Ingham, and I had mentioned in passing to ACIOH in a hallway that I was interested in doing a PhD, and that's when ACIOH mentioned if I was interested in looking at mental health and oral health. And I remember standing there nodding and smiling as ACIOH is telling me all about oral health, and I remember saying something like, "Oh yeah, that sounds really interesting," but in the back of my mind I was like, it's actually really boring. I don't want to do that. We don't do anything about oral health in mental health. I want to do something that's going to revolutionise nursing. And at the time I was working in mental health HDU, and I went back into the clinical setting and suddenly everyone had oral health problems. I was ordering mashed potato for a gentleman who couldn't chew anything because he had really bad dental pain. And someone else was requesting paracetamol for a toothache, and someone else was on antibiotics. So I did come back to ACIOH and I was like, I think oral health is actually a significant issue in mental health, and I will pursue that as a PhD. It was that experience that led me to understand the importance of interdisciplinary collaboration to improve the health disparities of some of the most vulnerable populations. So as a clinician working full-time and in the mental health service, as well as public health at the time during the peak of COVID, on reflection, it was a really crazy time to start a PhD. It was that having that link between the LHD and Ingham and ACIOH that really made it possible for me to be able to do my PhD. I was very fortunate enough to receive study leave and leave for conferences, as well as having a service that appreciated the research skills that I was developing. And I was able to put the studies that I was doing with my PhD and the skills that I was learning into LHD projects, and as well as mentoring nurses that were interested in research. So this opportunity and this collaboration has allowed me to be on a national working party, bringing over an oral health initiative from the UK for people living with a mental illness, and collaborating with clinicians in Australia, such as psychiatrists, who are interested in doing the similar work that we're doing in the space of mental health nursing. And more recently, I was able to write a perspective piece with a psychiatrist for the Psychiatry Journal for predominantly psychiatrists and doctors as a nurse, and being able to showcase what we're actually doing in that mental health nursing space. So this collaboration has given me the opportunity to attend multiple research events and present what we're doing, as well as win a number of awards this year. I mean, all those achievements are great and you can read about them in the report, but I really want to use this last 30 seconds I have to just talk about the amazing and unique experience and I guess environment that ACIOH has provided me. Being able to work with other people that are really passionate about improving oral health, being able to work with dietitians and who else do we have? Other nurses, podiatrists, all kind of focusing on oral health is a really unique experience, and just to be so supported and to be able to learn from each other has really enabled me to be able to pursue my PhD. So thank you.
All right. So that ends all the messages. So you've got a broad range of messages from industry partners, policymakers, students, and universities there. I hope you can see from today's celebration, I hope you can see that today's celebration wasn't just about me, my team, or Western Sydney University. It's really celebrating the benefits of true collaboration and acknowledging that we are stronger together than apart. Our report and presentations today has shown that we can all work together, whether it's health services, state governments, or universities, as long as we embrace the values of respect, openness, trust, and integrity. In terms of what next for us, in terms of future, at a national level, we want to leverage our recent success with the MRFF and NHMRC grants and seek other competitive funding, including being recognized as a Center for Research Excellence. We also plan to continue working with existing and new partners nationally and internationally to scale up models of care across the lifespan and expand the use of digital health platforms through the Perich Center here. Internationally, we also hope to work with the WHO to support the implementation of their global oral health strategy around integration. And lastly, around research and training, we plan to establish dual PhD programs with partner universities internationally so that we can cultivate future leaders and champions in integrated oral health care. Many of you may be aware a lot of universities are setting up campuses in India. Our university is setting up a campus as well. So we've got quite a few tie-ups with leading national and government and private organizations there. And we've already started the conversation around dual PhD. So I would like to take this opportunity to thank the School of Nursing Midwifery at WSU for supporting oral health integration for the last 10 years and making me and my team feel so welcome. A huge gratitude also goes to the Ingham Institute for giving us a home where ACIOH could grow and innovate in a supportive environment. To our partners, nationally and internationally, thank you so much for believing in us and trusting us to address your research priorities. To our PhD students, previous, current staff, and affiliates at WSU and other universities, you guys have been absolutely amazing. Being the engine driving ACIOH, none of this would have been possible without your dedication and hard work. And lastly, to our advisory board and the NEO network, thank you for your ongoing support and advocacy across the country. A very big thanks also to my team for putting the report together and arranging today's proceedings, especially since I was overseas for the last 2 weeks. I just came back last Friday. To Liz and Branka from Ingham, thank you for all your help with this event, particularly the IT challenges. You've been a godsend, so thank you so much. And lastly, to all of you here and online for joining and making today a huge success. Now, I'm waiting for my glass, guys. I would like to end today's celebration by singing a toast. So could you please stand up if you don't mind? Raise your glasses. So thank you for an incredible 10 years of oral health integration and putting ACIOH on the world map. Here's to another 10 years of continued growth, putting the mouth back into the body and making oral health everyone's business. The sky is the limit for us. Cheers.
Yeah. Happy birthday, To ACIOH.
ACIOH.
So that ends the proceedings for today. We have exactly 5 minutes remaining, and I wanted to open the floor because I know I couldn't get everyone to talk today. Rhonda, would you like to say something? Hannah?
I had a video.
You did a video? When was the video? Did you send it to me?
No, just a little while ago.
Oh.
In their little pop-out rooms.
Oh, did you? That one, right? But you want to say something now? Yeah. And Hannah, I'm going to get you as well. All right. Last 5 minutes. You guys can sit down. Thank you.
Well, it was wonderful to receive the invitation to come here today. I was very fortunate to be the Dean of the School of Nursing and Midwifery when ACIOH first joined us as a limited term research assistant. We knew that he was going to be a future star, so we wiggled him in through the school and we got him into a senior lecturer position, and then we got him over to Canada. One of the advantages of that was the Centre for Applied Nursing Research, which was started many, many years ago, and which I actually in 1999 came to Western Sydney as director. But one of the advantages of being dean is that you have the resources and the opportunity to support individuals and projects that you really think have got the potential to add to the overall research in the school and the development of the school. And ACIOH was one of those people. I'm not at all surprised that he has the success that he's had. I'm not at all surprised that he's brought around him the team that he's had, and that he is doing exactly the same for his team as he experienced. He's giving them the support and he's giving them the opportunity to excel. So congratulations to ACIOH, congratulations to his team. I'm delighted that Ingham has taken on ASIO as one of their research centres, and I also look forward to another 10 years. By which time I'll probably be in my wheelchair.
What a wonderful day. And I've been with ACIOH for many, many years. I can't remember our very first meeting, but it was right at the beginning when I started as well, back in 2008 in Western Sydney. I think of ACIOH as the Secretary General of the United Nations of Disciplines. And I was looking out there and I was thinking, if we counted up the number of disciplines in here, what ACIOH shows is we can work together, and look what happens when we do. So thank you for your leadership. I am actually this man's supervisor, and let me tell you, I've never had anyone easier in my life to supervise. But he's a phenomenal human being. And I know ACIOH will be sitting there going, it's not just about me, but leadership is about curiosity. It's about strategy. It's about listening. It's about inclusion. But there's another characteristic that I think is sometimes forgotten in leadership, and that is kindness. And this is a kind man. And what has come out of that kindness is an organisation that I hope will be emulated across the nation and internationally for years to come. So to you, ACIOH, for your kindness.
Oh God, I'm getting emotional here, guys. 4 o'clock on the dot. Thank you so much for making this a success, guys. We've got a lot of wonderful photos, got a few videos here. Thank you for those who are willing to be taken into the interview room and doing some short interviews there. We will officially, some of you will get sent the hard copies as well. We couldn't print a lot. But I hope it wasn't too boring. You'll be able to see different perspectives. And thank you to the partners who travel a lot here. Much appreciated. Enjoy the weekend, enjoy the break, and let's all get some refuel ourselves and we come back invigorated next year. Thank you all. Cheers.